in relation to Down syndrome, let's do this CDM. This one, I need somebody to read for us. I need somebody to read for us, please. Down syndrome. I want somebody to read for us.
Okay. A 3-year-old with Down syndrome is brought to the clinics for evaluations of the development delay. Which of the following assessments will be the most appropriate for this child? Choose the best three answers.
Okay.
One is thyroid function test. Two is a hearing evaluation. Three is the echocardiogram. Four is genetic testing for Fragile X syndrome. Five is speech and language assessments. Six is brain MRI. Seven is vision screening. Eight is complete blood count. Nine is the liver function tests. 10, autism screening. 11, bone density scan. 12, abdominal ultrasound. 13, polymerase function tests. 14, growth hormone levels. 15, immunoglobulins levels.
Good. So which of these is the topmost investigations you want to do? The thyroid function test, hearing evaluation, cardiac echogram. And remember the rules about CDM. The question is talking about 3. So don't choose more than 3. If you choose more than 3 and even like you choose 5 and all 5 are correct, you still get 0. Unfortunately for some people, CDM will end in November 2024. And next year, April, it's only going to be MCQs. Okay. So if you plan on writing your exam next year, remember that there'll be no exam in January, and the exam will be in April onwards. And it is now going to be MCQs only. So Dr. Noor went for 1, 2, and 10. Dr. Sabine went for 3, 8, and 11, 13. So this is basically what are the routine, because there are some evaluations which are done for well baby checks when patients with autism come to the clinic, right? So what are the routine ones? It is thyroid function test, 1, hearing evaluation. This is a child who is 3 years old, and then speech and language assessment. Okay. Now, so you see, a lot of the answers are right, but there was a particular word which narrows these answers to these 3. Who can point that to me? A lot of the answers like complete blood counts and the rest are right. But there's a particular word in there which makes 1, 2, and 5 the topmost answers. Who can help me?
For development.
Developmental delay.
Developmental delay. So
Yeah,
the question did not just say a child with Down syndrome, which of the following assessments is the most appropriate for this child? No. The question said a 3-year-old with Down syndrome is brought to the clinic for evaluation of developmental delay. Which of the following assessments will be most appropriate for this child? So now it has put another layer on Down syndrome. So it is Down syndrome plus developmental delay. What are the investigations? So the answer is thyroid function test, hearing evaluation, okay, and speech and language assessment. Why? Thyroid function and hearing loss are common in children with Down syndrome and can contribute to their developmental delay. In which way will thyroid function contribute to development? It can affect their height, right? They can develop cretinism, because you will learn that hypothyroidism is the commonest thyroid abnormality, even though hyperthyroidism occurs in about 1 to 1.5% of children with Down syndrome, right? Number 2, speech and language assessment is also crucial. Why? Because if they can't hear well, if they can't speak well, it affects communication. And don't forget that when you're assessing development, you are not only assessing physical development, you're assessing language development as well. Doctors, please, are you following me? Please, are you following me? Good. So you read, and I think people are now catching on to it. So this was not just which evaluation is most appropriate in a child with Down syndrome. No, it was rather which evaluation of developmental delay. This is the trick. So why is cardiac echogram wrong, even though we need to do cardiac echogram in children with Down syndrome? Cardiac echogram is important for congenital heart disease, but not directly related to developmental delay. Number two, why is genetic testing for Fragile X not the right answer? It is not relevant to diagnose, Down syndrome. To diagnose Down syndrome. Why MRI is not the right answer? It is not routinely required unless that child has a specific neurological symptom, right? Why is vision screening not the right one? It is useful, but not directly related to developmental delay. What about complete blood count? Complete blood count is also helpful. And you realize that when I'm doing the deep dive, I'm going to talk about that. It is helpful for general health and follow-up of the patient in Down syndrome, but it is not necessary for developmental delay. So doctors, please, this is the other thing. Please make sure that if you are dealing with a question, is it a multi-layered question? So that you don't just say, oh, I've learned Down syndrome. I learned Down syndrome from MedCognito. And so as soon as I see a question, I'm going right in. Take your time and, get it going. All right? Good. So now let's do the other type of CDM, which is the fill-in. And this one, you have to provide the answer. Okay. And the question is, a newborn is diagnosed with Down syndrome based on characteristic phenotypic features. The pediatrician wants to confirm the diagnosis with genetic testing. Now, this one, you have to provide the answer. What is the most appropriate genetic test to confirm the diagnosis of Down syndrome? One answer only. One answer only. One answer only. Dr. Nandini, she said karyotyping. She was asking me, no, Dr. Nandini, be bold, be bold, be bold. It is not karyotyping, it is karyotyping. You're going to do it, so don't ask me, rather write it. Dr. Brody, I'm going to do karyotyping in this patient, okay? I'm going to do karyotyping. Good, awesome. So, the most appropriate genetic test to confirm, this question is about confirming is karyotyping. Karyotype analysis is the standard test to confirm the diagnosis of Down syndrome, as it can detect the presence of an extra chromosome 21. Alternative methods like, they have can be used for rapid diagnosis, but should be followed by full karyotype. All right. So there's other tests they do, but the one you need to know in order to nail down Down syndrome is karyotyping. Doctors, I have a question before I now go into a deep dive and, talk about this topic and what we've done. What has been your learning points today? Down syndrome, is it making a bit more sense now with the approach we used? Anyone?
Hello?
Dr. Patience. Yeah,
Can you
Dr.
hear me?
Patience. Yeah, I can hear you, Dr. Patience.
Thank you for the class. I think for me, my major learning point is being that paying more attention to the questions. I think initially I just read and I assume I know what the question is saying, especially for the first CDM question we did that specifically narrowed down what it was looking for.
Yes.
So I think I now think I will read more most of the questions more critically instead of just glancing and assuming that I know what the questions are saying.
Beautiful, 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 beautiful.